For Action News, I'm Anna Samovska. If you're trying to get your flu shot amid the partial government shutdown, well, you can still do so, but don't expect your efforts to be recorded with the CDC. The annual influenza program powered by the CDC has been shut down. This means employees won't be able to track the flu and help people get flu shots or detect and investigate disease outbreaks for as long as government shutdown is in effect. The CDC has also stopped offering assistance to states who rely on the agency to help them track unusual outbreaks. ACTIA's medical director, Dr. Gilbert Ross, weighs in.
The CDC's programs for surveillance of disease will definitely be hampered. They will not be able to track outbreaks of various contagious diseases. In this season, flu is a particular concern, although the flu season has really just barely begun, so it's not going to be a major problem, I don't think, unless this shutdown continues for more than several weeks. Flu vaccine should still be available, and we continue to urge everybody to get their flu vaccine now. On the subject of flu vaccine, a viewpoint published in JAMA, the Journal of the American Medical Association, discusses the new policy in New York State this season, which will require some degree of protection for patients in New York State's hospitals from influenza transmission from healthcare workers who might be carrying the virus. Unfortunately, the policy that New York State has adopted, and which seems to be supported by this viewpoint paper, is that healthcare workers coming into contact with sick, vulnerable patients, there has to be some improvement, and I'm afraid it has to be mandatory based upon past experience, because last season, only 36% of all the hospital healthcare workers did receive the flu vaccination. So patients, immunocompromised patients in the hospitals whose immune systems are not functioning well for a variety of reasons, or newborns who have barely any functioning immune system at all, will be vulnerable to contagion transmitted from healthcare workers who might be harboring the virus and not even be sick. This is not an acceptable position. The concept of first do no harm should be employed. The complaint that you can't make me take something into my body that I don't want to, which we've heard from some people, does not apply, because they don't have to be working next to sick patients. They can be working in some area where they're not exposed to patients, and vice versa, if they don't want to get the shot, because the shot is perfectly safe. The fact that some people say it's not completely effective is a phony argument also. Any protection is better than no protection, which we have now. So hopefully this policy will be tightened up, if not this year, the next year, to require flu vaccination for all healthcare workers.
To read more on the government shutdown and its effect on public health, you can visit our website, actia.org. Don't forget while you're there to sign up for our daily dose of news delivered right to your inbox. For Actia, I'm Anna Samovska.